You hear the term TMJ all the time. Everyone has a TMJ. TMJ stands for temporomandibular joint. The true phrase that we should say is TMJ dysfunction, because that is a normal functioning joint within the mouth and on the head, and it can create some issues. That particular joint is critical in helping us chew. There's a series of approximately 7 muscles on each side of the head that function differently to make that jaw open and close and move around so that we can chew. There's also a cartilaginous disc in the joint between the skull and the jaw that creates most of the problems. A lot of times that little disc gets displaced or dislocated temporarily, and that's where people start talking about popping and clicking and pain when they're chewing. That if a patient brings up certain key factors like a lot of headaches, difficulty opening, closing their mouth, face pain, we have a questionnaire and an information page that we give to the patient that will help us assess more specifically what's going on. We also do an examination called a range of motion exam, which measures how far the patient can open from edge of the tooth to the bottom edge, top edge of their bottom teeth. And then we determine how far they can rotate side to side to kind of determine how that joint in each side is a problem. Usually what we'll find from that exam is patients can't open very far, or they can't slide one way or another. And based on that questionnaire and my examination, I determine whether they need to go into a splint or not. And then we can begin to determine the best way to help them. I think one of the things we talk about when we get our initial problem presented to us is look at what soft diet and be careful about opening your mouth too wide can help the patient for a couple days. We will use NSAIDs like Motrin or ibuprofen to help alleviate any discomfort. And in some severe cases, we might even look at prescribing some muscle relaxants to help the muscles of the joint relax. Unfortunately, when you give muscle relaxants for the jaw muscles, it relaxes all the muscles in the body, and it can create some side effects where it might make you sleepy. So I don't like to do that very often. The other thing that we utilize once we get the patient to a certain point is we use an acrylic splint. A lot of doctors will use an upper splint. I'll use a lower splint. The splint basically is to provide a stopgap in between the upper and lower arch of the teeth to kind of keep the joint positioned in a certain way because of how it rests on top of the splint. And we got a lot of good results from that. There are also occasions where you might have to do surgery. That's out of my league. That's where an oral surgeon might have to be involved. But I would say I'm not totally against surgery, but I'll do my best to keep somebody out of surgery. So we are commonly faced with trying to make sure that that joint functions properly. If you have any questions about this video, please call our office. We'd love to hear from you, and we will do our best to answer your question, and if necessary, make you an appointment with a doctor.